Hello everyone. Just to finalize on the clinical anatomy of the abdomen. So we have what we call aortic aneurysm, which is dilatation of the aorta. It mostly occurs on the infrarenal part of the aorta. So this usually presents with a pulsatile abdominal mass, abdominal pain radiating to the groin, and tender abdominal mass. As you can see that dilatation, we call it infrarenal segment. It's a part of the aorta after it has given out the renal artery. So usually in extreme dilatation, the abdominal aorta can rupture, leading to massive hemoperitoneum, bleeding within the peritoneum, and that can cause death. Then remember the site for portocable anastomosis. This is where you have communication of blood vessels, veins that take blood to the portal vein, and those that take blood to the vena cava. So we have at the lower esophagus, left gastric vein will take blood to portal vein, while we have tributaries to the azygous vein into the vena cava. At the anal canal, superior rectal through inferior mesenteric vein to the portal vein, while inferior and middle rectal veins go to internal iliac and pudendal veins and eventually to the inferior vena cava. Within the pelvis, we have rectal plexuses that communicate with vesical plexus, prostatic plexus, uterine plexus, and vaginal plexus. The rectal venous plexus have a communication with the portal vein, while the rest communicate with the inferior vena cava. At the umbilicus, we have epigastric veins and that communicate with the portal vein through ligamentum teres. At the bare area of liver, we have hepatic venules and the veins of the diaphragm and thorax. Then at the intestines and the spleen, we also have the communication between colic veins, splenic veins that drain to the portal vein, and renal and lumbar veins into the vena cava. So why is this important? Because of what we call portal hypertension. This is the increase in venous pressure within the portal vein above 20 centimeters of water. It's caused by three subclasses: suprahepatic, intrahepatic, and intrahepatic causes. So suprahepatic, like in heart failure; intrahepatic, like in cirrhosis of the liver, which is fibrosis of the liver caused by different things; and intrahepatic causes like thrombosis of the portal vein. So this site of portocable anastomosis will have dilated tortuous veins, and usually they are weak and they can bleed. For example, esophageal varices. So the vessels at the lower esophagus will be dilated and tortuous, and when it worsens, it can lead to upper GI bleeding. Then we have caput medusae, which is enlargement of vessels, paraumbilical vessels, and then rectal piles, what we call hemorrhoids, around the anal canal. Again, because of the rectum being a site for portocable anastomosis. So this diagram just shows you at the lower esophagus you can get esophageal varices, and at the rectum you can get rectal hemorrhoids. Thank you very much.